Good afternoon, everybody. I'm so excited that I had this opportunity to talk to you today about mental health awareness. I'm Jill Mays, the Director of the Office of Behavioral Health Prevention and Federal Grants here at DBHDD. And this role, I think it's probably a dream job for me because it gives me the opportunity to help out on lots of different levels of the continuum of behavioral health care. And the prevention side is really exciting because this is where we get an opportunity to promote mental health awareness and those things that we can all do in terms of self-care and resiliency factors and all kinds of skills that we can put in place that can hopefully prevent mental illness or substance use disorders, or at least to help mitigate circumstances and help people get on the road to recovery sooner. But what I really wanted to talk to you about today, I guess, in terms of mental health promotion and why it's so important, I guess is the stigma is what I want to talk about. I just want to be a little transparent, share with you kind of personally about that. As a mental health professional, there was a time when, I really felt like I should be able to handle all of my problems, my stressors, my triggers, all of that on my own. And as a mental health professional, I started to feel some things, but I didn't feel like it was safe enough to kind of let people know what was going on with me. Because after all, I'm the helper. The helper shouldn't need help, right? Very wrong. And so I didn't really address my symptoms and my issues related to major depression probably as early enough. It got to the point where, there was a time when I was experiencing not getting out of bed in the morning, not wanting to, take care of the activities of daily living. And there was a point where, I was having some suicidal thoughts, and it didn't have to get to that place. But because of the stigma, even, outside of work, I'm a minister, and, I counsel people all the time on the benefits of spiritual practices and how prayer helps. And so it was really hard for me to just reach out and let anybody know that I was struggling because of what I thought people might think. And I think stigma, we got to strike it down because it's keeping people from getting help. It's letting people stay on the road down way too long. So we all got to work together to promote mental wellness, to make self-care, something as important as physical exercise, to make it just a popular, trending thing to do to take care of yourself. Because there are people out there who are dying. There are families who are being crushed and devastated. And this doesn't have to happen in this day and age. We can make it okay to not be okay. And I wish that, I had learned that lesson longer, but thank goodness for the behavioral health system that we have here in Georgia, great providers in the private sector and the public sector. There's help out there, and I was able to get with a couple of really great therapists and work through my issues, and I feel like I came out, stronger on the back end and a much better therapist and a much better person. I think it really equipped me for the role as Director of Prevention because for me, this is my passion. This is something that I'm championing, mental health awareness, because I don't want people to have to suffer. It's unnecessary. We're all in this together. There's help. There's resources available. We just have to make it okay to open the doors and for people to walk right in without fear of embarrassment or reprisal or shame, or that nobody will believe them or will tell them it's all in their head. All of those are myths. None of that is true. The truth is it's okay not to be okay. There's help available, and everybody should have access to it. So I guess that's all I wanted to say today. So I hope what you walk away with is that, again, we're all in this together, and there's no wellness, no physical wellness, no health without mental health. And so I want that to be one of your takeaways for Mental Health Awareness Month. No health without mental health. Thanks a lot for listening. Bye.
Hi, my name is Debbie Atkins. I'm the Director of the Office of Crisis Coordination for the Department of Behavioral Health and Developmental Disabilities. 1 in 5 adults in the United States will experience a mental health condition in their lifetime. Alongside them are the fathers, the mothers, the children, the friends, and countless extended relationships that are affected as well. Whether you suffer from anxiety, depression, or helping a loved one cope with persistent mental illness like bipolar disorder or schizophrenia, you know that the condition is difficult to live with. It is also isolating, all-consuming, and affects many areas of your life. May is Mental Health Awareness Month. It's important to raise awareness of mental health so individuals will feel more comfortable in seeking help early. This can result in quicker recovery. By being more aware, mental health can now be recognized as an illness. Mental illness is treatable, and individuals can lead a life of recovery and wellness. When mental health conditions are viewed as an illness, individuals feel less stigma in seeking help. An illness does not define you, it's just a part of who you are. Of the 20% of adults who suffer from mental illness, less than half seek treatment. You don't see these statistics in any other health-related issue like diabetes. I was drawn to the field of counseling because I've always believed that every person needs access to quality treatment and to be shown respect and to be able to maintain their dignity while receiving care. In my role, I have a few functions I'm tasked to do. I develop pathways to access DBHCD's crisis services such as mobile crisis, the Georgia Crisis and Access Line, or GCAL, and our crisis stabilization units. I research best practices and ensure training of our system, and I coordinate with first responders like law enforcement and emergency departments and our mobile teams to make sure that pathways are working for individuals in need. When someone accesses our crisis system, it's one of the most difficult days of their lives. As I talk with providers of these services across the state, it's important to remind them of this. Just as a heart surgeon encounters a person on their worst day in an emergency room who suffered a massive heart attack, our providers encounter individuals who are suffering from acute psychosis, panic attacks, overwhelming depression, manic episodes, and overdoses. Whether this is the first time or the 50th time they've sought our services, they should be welcomed for making the choice to seek help. We strive to encourage our system as staff with persons with lived experience, to greet them, engage them, and provide hope in a time where they feel hopeless. You can help. Be informed of the signs and symptoms of mental illness. Encourage those you know need help to seek and reach out. They can call our Crisis and Access Line. They can reach out through our text and chat lines, or ask for mobile crisis teams to meet them where they are. They can receive the help they need and deserve. Be an advocate for quality care, for support for those you know by listening and being there for them. Attend a mental health first aid class or volunteer at NAMI or Mental Health America. Remember, don't judge a person's story by the chapter you walked in on. So much more happens as the story unfolds. By providing hope and care to those in need, we can all be a part of a happy ending. Thank you.